Good afternoon, everyone. Is everybody ready? All set to go. I just want to say thank you for coming, and again, reassure people that the City of Worcester is still taking this very seriously, and we're still in the beginning stages, and we have been working 24/7 with our health department and our emergency team, and we'll continue to do so. And so I know I say this every time: still practice good hygiene, cough into your sleeve, keep distance from other people if you can, and also take care of one another. Check in on your elderly, make sure that everybody's being taken care of. The city's doing a good job, both on the city side and the school side, of feeding people here in the city of Worcester. And I know the CDC came out with some further recommendations today regarding surface touching. It seems to be one of the biggest spreads of the virus, they're thinking right now. I know the manager put out a release to real estate agents. Be careful at the open houses, or even recommendations to close the open houses, and et cetera. So that surface touching seems to be a big issue here and around the country. Just got some announcements I just want to make. Under the emergency declaration, the city manager ordered on March 15th, as requested by the city council and Gary Rosen, that we have decided to delay the implementation of a ban on single-use plastic bags in the city for 90 days. The ban was scheduled to go into effect on April 1st, and now won't go into effect until July 1st. This will give businesses impacted by the crisis more time to adopt to this new change. It's also in the best interest of safety not to introduce more reusable bags in the circulation right now, which could cause the spread of the COVID-19 virus. There is evidence that the viruses and bacteria can survive on reusable bags up to 90 days. Just have an update from the Public Works Department. The DPW walk-in service is now closed. The customer service center will still be available remotely by calling 508-929-1300 or by emailing dpw@worcesterma.gov. Service requests can also be submitted using your online system at worcesterma.gov/customer service. Trash and recycling services are still on schedule, so people should realize we are still picking up the trash here in the city of Worcester. Worcester drinking water is safe. There's been some questions on that, so I'll reiterate that. The Worcester drinking water is safe and unaffected by the COVID-19. Worcester's drinking water comes from all well-protected reservoirs and is treated using ozone and chlorine, both powerful disinfectants that destroy viruses like COVID-19. Worcester area residents who get their water from the city of Worcester public water system should not, I'll say it again, should not be concerned about the safety of their tap water. Also, the Green Hill Park Farm and all playgrounds are closed until further notice. City parks and open spaces still remain open. And there's another thing that's been discussed today is scams involving the elderly and Worcester employees coming to their homes. Please be aware, if a Worcester employee comes to your house, do you have an ID that tells who they are and who they work for? And if you have any questions on people calling you and trying to scam you out of money, you always can please call the Worcester Police Department to make sure that we address your concerns. I'd like to introduce the city manager for his comments and his statement. Thank you.
Thank you, Mr. Mayor. As of today, we have no new positive cases, and I might mention that they have changed the phrasing. Used to be presumptive positive, now they're asking us to call them positive cases. So it's the same thing, but they've just shortened the classification of the cases to positive cases. So we still have the 3 that we talked about yesterday, as well as the 2 that were Worcester, folks who worked in Worcester but lived in one of the area communities. We do know of other positive test results from our Worcester hospitals and other locations, but they have not come down to us through the Department of Public Health as to where they are residents or where they may have worked. So because our health centers provide regional health care services, until that process kind of works its way through, there's a bit of a lag. We don't know exactly where those folks are from. But we certainly should expect the numbers to continue to grow. Our communication center, I mentioned this yesterday, which is really our 911 call takers and dispatchers. We had split those into 2 sites here in a separate room that is only available to the folks who work in that room. None of the rest of us are allowed to go into that room, so as to protect them from being exposed. We opened a second site at our McEwen Road Fire Station, and we are preparing to open a 3rd site. This is one of the most important functions that we provide as a city, is people who can take calls and dispatch ambulance, fire, and police services to people when they need it. So we need those to have several redundancies in place. So if there was an outbreak in one location, we would have enough folks who are trained to continue to make sure somebody's answering the phone and dispatching the proper first responders to folks in need. As I mentioned yesterday, as of today, all of our city buildings are now closed to the public until further notice. Full directions on how to conduct city business and to contact city departments, as well as to how to participate in our public meetings, is available on the city's website, worcesterma.gov. So if anybody has a agenda item on the planning board, on the zoning board, on the conservation commission, the Board of Health, whatever it may be, and you're trying to figure out when is the meeting and how do I participate in the meeting, if you go to worcesterma.gov, it should have the list of the meetings as well as the process by which you can participate in those meetings. So some of those core meetings will continue, albeit remotely, in terms of public access. Today, I'm very happy to announce the formation of a partnership. It's called Worcester Together. It really is a partnership between the City of Worcester, the Greater Worcester Community Foundation, and the United Way of Central Massachusetts. This partnership will help fund local relief efforts for COVID-19. It's going to combine the efforts of the Greater Worcester Community Foundation's COVID-19 Response Fund, and that one is really going to be focused on the longer-term impacts of this. As I think is becoming increasingly clear, this is not something that's going to go away in the next couple of weeks. This is something that our community is going to feel the impacts of for months, if not longer, down the road. So the Greater Worcester Community Foundation fund is going to help us with those longer-term needs in terms of the impact on our community and particularly our vulnerable members of the community. The United Way set up a COVID-19 We Care Fund. That really is going to be focused on the more immediate needs as we ramp up emergency shelter, as we try to get food and other important supplies to, whether it be our homeless, our elderly population, immigrant refugee families, folks who are very much vulnerable. That United Way Fund is going to provide us the resources to meet those needs immediately. The foundation, the Greater Worcester Communities Foundation Fund, has been seeded with $535,000. This again is this fund is available for more donations. We know that's not going to be enough. The $535,000 is from the Greater Worcester Community Foundation themselves, which is a very generous gift to get this going. We are hoping that other foundations, businesses, individuals who want to help and are looking for opportunities to help, these are the kind of funds that you can contribute to and know that they're going to be coordinated with the city and with other community-based organizations to help meet those needs. We urge people to go to the greaterworcester.org site to make those contributions. I did have a conversation with many of the family foundations in Worcester today, and they are all planning on stepping up and being generous to that foundation. So I really would appreciate it if the city's media would help publicize those websites and locations and get the word out to folks who may want to contribute. The United Way, again, seeded their fund with $100,000. which is going to help kind of get this underway. That really is geared at the safety net programs here in the city. And we urge people who want to give to those more immediate needs to go to the United Way CM, UnitedWayCentralMass.org, and please give generously to help us meet those emerging needs in our community. Information, again, on both of these funds and how to donate can also be found on the City of Worcester's website, worcesterma.gov. Since the outbreak, the unemployment insurance system has seen a large spike in claimants. In just 24 hours earlier this week, there were more than 20,000 new claims filed. To put that into context, this is more than the total amount for the entire previous month. The City of Worcester and our Mass Hire Career Center are working closely with our state partners to assist people and companies affected economically by this pandemic. An expedited unemployment process has been implemented for claimants, and although the Career Center facility is closed, staff are still providing services remotely. Again, information about for claimants and for businesses is posted at the city's website, worcesterma.gov. We're trying to make one-stop shopping. So if you're somebody who's been laid off or fear you might be about to be laid off, go to that site. There will be links there to a new shrunk-down form to apply for unemployment benefits. Or if you're a business who knows you're going to have to lay off some employees, you can go to that site and send your employees to that site for assistance. We're grateful to state officials that have helped to waive regulations and procedures where necessary to help make unemployment claimants receive benefits quicker, and to pause the sanctions for those unable to meet the program requirements due to COVID-19. We are working locally on the creation of a workforce matching tool. This is really important that we get this word out to folks. We've been contacted by groups who want to hire people because they may be cleaning companies, and all of a sudden there's a huge demand for folks to come in and do deep cleaning in different facilities. And then there are people who've been laid off who are desperate to find work. What we're doing is we're going to create a matching tool that allows people who are looking for work to meet up with people who are looking to hire people. And that platform should be rolled out in the next couple of days. I'll do that here at these press briefings as a way to kind of meet both sets of needs, getting workers to places where we need workers and getting people paychecks who need paychecks. Anyone that needs to file an unemployment claim should be using the online system. That's mass.gov/DUA, mass.gov/DUA, as there will likely be delays for the phone system while the Mass Department of Unemployment Assistance ramps up their remote call center. To this end, again, the Worcester City is assisting with departments, with the department and staffing that remote call center with employees from our career center that are being temporarily reassigned during this crisis. So we are taking our career center employees and we're trying to pitch in with our state partners and help them expedite folks' access to unemployment claims. Yesterday, I announced that we were suspending the Worcester Fire Department Academy until further notice. I want to update folks. I met with the Fire Academy recruits today and informed them we are going to continue to keep them on the city payroll while the academy is suspended, because we don't want all of those 28 recruits and their instructors to be in one closed classroom, which is contrary to all of the guidance that we're giving out and we're being given. So we are going to use them to help support the citywide efforts to combat the virus. So whether it be helping set up shelters, whether it be putting together toiletry kits for the homeless, all of the various things we may be doing, we're going to keep those recruits employed to help us do some of the other needs that we have. And as soon as we can reconstitute the academy, those folks will pick back up where they left off. I also want to be clear, because we've gotten a lot of calls about this, some confusion, people who have home closing dates for purchases of new homes. And there's some confusion about whether the Worcester Fire Department is doing smoke detector inspections, which is, of course, a requirement in order to do a closing on your home. We are. The Worcester Fire Department continues to do smoke detector inspections for new home sales as usual. So not to worry if you have a scheduled closing, you can get that home fire detector inspection done to do your closing. A couple updates from the Worcester Police Department. Many of our cruisers and vehicles are used by 3 shifts of officers, so the same cruiser is used by each of the shifts. And so we have crews coming in who are cleaning those vehicles thoroughly between shifts to ensure that if there's an exposure by one officer, it's not infecting another shift of officers who are using those same vehicles or those same workspaces. So we are really trying to be aggressive in those cleaning protocols. Again, the Worcester Police Department, like all departments, has been working cohesively with our other departments. Worcester Police Department obviously has been and will continue to do all of the emergency call response. So somebody has an emergency, the police department will show up. For non-emergency calls, we are hoping to have more use of our non-emergency phone line, which is 508-799-8606. If somebody wants to file a complaint or other kind of less emergency assistance, we're urging them to use that non-emergency line where officers can take those reports over the phone and limit that face-to-face contact as much as possible. Although the lobby of the police station is open, sometimes folks are having to bail out a loved one. We are trying to keep as little contact and interaction as possible. The license division in the Worcester Police Department is closed to in-person visits. However, folks can reach folks in the license division by calling them at 508-799-8648. A couple of updates on elder affairs and our senior center. Today, 1,390 meals were delivered to seniors throughout the city of Worcester by the Meals on Wheels program. We have 600 other seniors who are registered with our Worcester Senior Center. Each day, we're calling about 150 of them, asking, how you doing? Do you have everything you need? Anything that you're running out of? Any needs that we can help you with? And anybody who identifies an unmet need in our senior population is then referred to one of our partner agencies who have CORI-checked and approved folks who can do a run to the grocery store or pick up a prescription or otherwise meet the needs of our elderly and vulnerable population. We're going to continue to do those calls every day, so each senior should get a call about every 4 days who are signed up for that program, about 150 calls a day. As I mentioned, we're continuing to work on our homeless sheltering plan and hope to have something on that in the next day or two. Our cultural community are coming together like the entire community is, really trying to help support parents, family, and really anyone who's feeling isolated in their homes during this time of school closures, business closures, now with the governor's orders around child care facilities. We want to support folks and as Dr. Hirsch has eloquently talked about, create other kind of connections within our community. So we have many local performers, entertainers, who've used social media to perform live shows. We're working with our other more large cultural institutions to create videos, live events. Folks can go to culture@worcesterma.gov. There's some examples there. We're reading books for children, hosting virtual tours. We've talked to folks like the Art Museum, where we can do all sorts of kind of engaging content with our cultural community and really keep people busy, keep people entertained, keep our cultural community and our artists in the community continuing to be active. Our cultural coalition plans to host and circulate this creative outpouring of content in an effort to keep spirits high and to sustain our community spirit. Again, our COVID-19 information line, 508-799-1019. These services are available in English, Spanish, Vietnamese, and as of today, Albanian. Starting tomorrow, March 19th, it'll be open for live conversations with nurses between 9 and 4. That service is available for folks who test positive as well as folks who are awaiting test results. So if somebody is tested positive or somebody is awaiting test results and wants to talk to a live nurse, get advice, discuss their unique situation, during those hours there'll be a live nurse available to them. We'll continue these briefings again tomorrow with further updates, and now I want to turn it over to Dr. Hirsch.
Thank you, Mr. Manager and Mayor Petty. We don't have a lot of breaking news about the burden on the hospitals. The hospitals seem to be, thus far, coping with the level of inpatient work and emergency department work that they're doing. The good news is that both now have drive-through capability. St. Vincent's and UMass have drive-through testing capability. And there are some criteria we can talk about what gets you a test. If you have fevers and a cough, and in addition to that, you have had exposure to a known positive person, you will definitely get a test. If you have been in any of the now 6 level 3 countries, including now Spain, which has been added to China, Japan, South Korea, Italy, and Iran, you will get a test if you have symptoms. If you have symptoms and you just are in a position where your work is considered mission critical for the safety of the city, if you're a first responder or a medical provider, you will get a test. At St. Vincent's Hospital and at UMass, if your primary care physician writes you a prescription for a COVID-19 test, you will get a test. We're trying not to abuse that last category, and I've done a lot of work today with the Worcester District Medical Society and its president, Dr. Dave Passy, to try to educate the 2,500 doctors within our Central Massachusetts Organized Medicine Organization so that they don't just merely write the prescription for a test because someone has been calling the office multiple times. We want some thought to go into this because we are unfortunately still short on tests, and witness the drive-through facility at St. Vincent's ran out of tests in the late afternoon today. They're expecting to get a new shipment in tonight, and we're fully expecting that they'll be operational again tomorrow. But we're still dealing with a lag time of testing and the length of time that the test takes to come back has been very frustrating for everyone. So I think we are going to get better at the testing. I think we're going to get better with the type of tests that we're administering. There'll be shorter turnover time, but we're in the early phases now, and I think, unfortunately, we'll have a lot of practice by the next month or so. I think things will be a lot more streamlined. The great thing that I can report, at least, is that the spirit of our caregivers and I would say the attitude of our patients that are coming in worried is really, really very inspiring. Everyone wants to step up to the plate. A lot of the people that are coming in to be tested are not thinking of themselves, but they're worried about their work situation, and are they contaminating their loved ones at home or their loved ones at work? They're really thinking about the greater good for the greatest number, and that's really very, very heartwarming. The other thing that happened today at the medical school was we made contact with Dr. Benenda's digital learning specialist within the Worcester Public Schools, and we're hoping within the next week we will have an organized system whereby our medical students, who are really chomping at the bit to help in any way they can, to help educate, to help entertain the students that are out. And similarly, we're going to have a meeting about this on Friday, so we haven't fleshed it out, to help with some of those kinds of phone calls that the city manager referenced for the folks at the senior center or the known geriatric patients in our populations in both hospitals, that we could potentially just be a friendly voice and kind of get a chance to kind of understand what their situation is and how they're doing, and hopefully intercede if we feel like they need an intervention of any kind. Lastly, I would say things as far as the closure of daycare centers. I think this is very timely. I think Governor Baker did an excellent job. The data that's coming out of Italy and Spain seems to show that although the children, fortunately, are not getting sick with this virus, they are passing the virus through their feces. So the diaper changes that young parents are doing are exposing the millennials and slightly older folk to the virus. And I think that's really why we want to kind of limit the amount of traffic through these daycare centers and the amount of exposure. It's very hard to keep those kids from exposing people if they really are carrying. So again, I think just in the early phase of this in Worcester, I suspect that this number of cases that we're reporting each day of 3 is going to balloon. And I think the last thing I want to do is have you have the impression that if by Friday the city manager reports that we have 10 cases or 12 cases, that it means the tsunami has hit. It's just, as he mentioned already, there is a lag time about the reporting system. Everybody has to go into a database, has to be reviewed by the epidemiologist at Mass Department of Public Health, and then it gets sent back to us as a confirmation. So I think the cases are already here. We just haven't necessarily gotten the testing to document it. And once we do, I think we may be reassured that all of this social distancing that we're doing is really helping stem the tide, because we're not nearly at the pace of increase that we're seeing in other parts of the country or certainly other parts of the world. So I think so far, so good. I know that's a tough way of looking at a pandemic like this. But I think everything that we're going through as a community and the way that we're facing this together is very encouraging, that we're going to, ride through this, and hopefully there'll be some discomfort, some pain, but not the mortality that we've been seeing in Italy and China. So, thanks.
Just a quick update while we were here. We heard that there's a 4th case, so obviously I don't have the details of that, but share that in real time. Okay. Questions?
Where is the 3rd center going to be open? We have here, we have at the fire station, you said there was a 3rd one that was going to be open?
Yeah. I'm not sure if it's going to be the police station or one of the other fire stations. I'll have to get back to you on what the location is.
Do you feel that, obviously, you guys are projecting that the city is doing everything it can. Do you feel, even just anecdotally, that people are taking it seriously, the populace? Do you feel like there's still too many people running around out there, too many cars on the road, it seems like, do you feel like, I mean, I don't know, what's your take on how people are taking responsibility for this?
I think by and large, people are taking it seriously. You know, you do see cars on the street, but people are going to the grocery stores, or some people are essential employees, they're going to work. I haven't seen large gatherings, which is really what we're trying to deter. I think every day people understand more and more the seriousness of this. You see the cases nationally just going up by the hundreds in the course of a workday. So there's always some people that don't take it seriously, but I think by and large, I've been impressed with what I've seen and what I've heard anecdotally, that people are doing the responsible thing and keeping their distance, trying to follow the protocols.
Are you concerned about St. Vincent's running out of tests today, and is that something that we might continue to see at St. Vincent's and at UMass in the coming days?
We have our daily Mass Department of Health discussions, and this comes up in every community. Not enough testing kits, and how can we get more testing kits? Now that we're accessing private labs, I think the access is going to be better, but it's not perfect, and St. Vincent's is using an outside lab, and I think what they were very surprised about was the volume of people that came in today. So we're probably going to see shortages emerge, but I think that that's one of the highest priority things that the Mass Department of Public Health and the CDC are going to try to do is get us the kind of consignments of these tests that will reduce those drastically.
Do you know how many people went in today?
I don't. I didn't have a count.
All set then? So, yeah, I think Worcester is taking it seriously, but I think we got to reiterate the fact that if people need not go out, don't go out. You know, I think the governor's made that clear, the president's made that clear. And I think you just have to keep on sending that same message, and because we didn't close down the Worcester buildings for nothing, and we have a lot of personnel out there who are spending a lot of time to get this right for the people of Worcester. So thank you, everyone, for coming. Much appreciated.